I'd like to welcome you all to a second webinar in the CHAMPS COVID-19 Response Summer Series. I'm going to just go ahead and start the webinar now. Today, we're excited to be able to share first-hand stories from mothers describing their recent childbirth experiences during this ongoing COVID-19 pandemic. This webinar will be recorded and posted on our website in the next couple of days for your future reference, in case you would like to go back and rewatch it or share it or revisit it for any reason at all. Yes, so before we proceed though, I would like to discuss a couple of other things. The first thing would be like our next CHAMPS webinar. The next upcoming CHAMPS webinar in this series is the July 1st webinar. That's next Wednesday, same time, and it's titled Creative Hospital and Community Interventions During COVID-19. And in terms of CHAMPS updates, we've been sending out the chair newsletter. So if you haven't received our newsletter and you would like to be included in our mailing list, please feel free to put your email in the chat box, and we would be sure to add you to that list so you can get the newsletters from us with all of our latest updates. We also have launched officially the CHAMPS Q&A forum, which is a platform for you to where you can view and submit questions and answers. And yes, so you can access that through the website on the screen. That's shareequity.answerbase.com. So yes, now we're going to go ahead to the presentation. But before we begin, we would like to express our deepest appreciation for all the mothers who took the time away from their babies and everything else that's going on in their lives, to stories that we can all learn from as we go forward supporting mothers and working in maternity care through this ongoing COVID-19 pandemic and hopefully afterwards. And I would like to also, the CHAMPS team would also like to express our deepest gratitude to all those who helped us gather these stories so we can share them on here today. So without further ado, we would begin hearing from our mothers. Thank you.
First, we'll hear from Stacy, who recently gave birth at a hospital in Weymouth, Massachusetts.
Hi, I'm Stacy. This is my daughter, Natalie. Natalie is currently 12 weeks old. She was born on March 25th, 2020 at South Shore Hospital in Weymouth, and I was asked to share a little bit about my experience becoming a new mom during the COVID pandemic, so that's what I'm going to do. I will say that Natalie is my first pregnancy, my first child, so I don't have anything to compare it to, but it's definitely, things have been different than what I was expecting because of COVID, to say the least. So I was asked, how was my prenatal care affected? I had a normal pregnancy up until 36 weeks, and at my 36-week appointment, my belly was measuring small. So I was brought in for an ultrasound, and Natalie was measured really small. So she was in like the 5th or 6th percentile for weight for her age. So after that, I was monitored really closely for the last couple weeks of my pregnancy, and I would go into South Shore Hospital for ultrasounds and fetal non-stress tests at least once a week, if not every couple of days at some points. And for the first few, my husband was able to come with me, and after that, because of COVID, he was not allowed. So the hospital was only allowing patients and no partners or caretakers at those appointments. So going to those appointments by myself was really stressful because the nature of the appointment, I had a lot of anxiety about, just the results of each test. And there was always the possibility that if she wasn't growing the way we wanted, that I would be induced to bring her out earlier. Luckily, that never happened. I ended up carrying her to full term. But just to go into those appointments and know that if I got any bad news or anything was happening, I was there by myself was really scary. So then leading up to my due date, a couple weeks before my due date, I found out that I wasn't going to be able to have any visitors in the hospital. So that meant that my family and my husband's family, whom we had planned to have come visit us as soon as she was born, wouldn't be able to come. And I wouldn't have thought that would be so upsetting, but I was devastated when I found that out. I remember just sobbing on the couch that night. It was really sad. I called my mom. I was really upset. And I found that out actually from a coworker who knew someone that was in the hospital, and I confirmed it on the hospital's website. But I don't think that anyone, when I went in for the test at South Shore, mentioned that to me themselves, which if I had just found out for the first time when I was in the hospital having her, I would have been really upset. So that would be one thing I would say, just a little more proactive communication around that would have been great. But I know that's, it's really tough. And the nurses said when I was there, and I totally understand, that the situation was kind of changing every day and the hospital's policies were like evolving constantly, just because it was such a fluid situation at that point. So then when I went into the hospital to have her, backing up, before that, about a week before my due date, news was coming out of like New Jersey and New York about partners not being allowed in the delivery rooms with moms having babies. And that to me was just horrifying. I was so scared of that happening here. Obviously this being my first child, I really wanted my husband to be there. And for him also, he wanted to be there. And the idea of not being allowed in was just, something that he couldn't even fathom. And luckily it didn't obviously come to that in Massachusetts, and he was able to come with me, but we had a lot of anxiety about that before she was born. And as my due date got closer, I remember my husband and I talking about it, and we just felt like, I just want to have this baby, like get into the hospital, have her, and then come home so we can keep her safe at home, because things just felt so uncertain at that time. Luckily, my husband's job was, he's able to work full-time from home. So a couple of weeks before we had her, when everything started shutting down, he was working from home. So in a way that was kind of nice. It's kind of a silver lining, because he was there with me, as I was getting ready to have the baby. So that was actually kind of nice. But yeah, we were just like, oh my gosh, let's get into the hospital, get home. When I did go to have her in the hospital, at South Shore Hospital, like I said, so I went into labor in the middle of the night at 1 a.m. My water broke. So we went to the hospital, and when we got there, we were asked, several times at every admission point, have you been in contact with anyone known or suspected to have COVID? Have you traveled? Do you have these symptoms? So it was clear that they were really screening for it, and most of the staff that we encountered were wearing masks, which was good. Made us feel a little safer. We weren't asked to wear masks at the time. And overall, I would say the staff definitely made us feel like they were taking a lot of precautions to make sure that, we weren't in any danger. One of the big things was that we were not allowed to leave the delivery room first, and then once we were transferred to maternity, we weren't allowed to leave the maternity room. So not just me, my husband was not allowed to leave the room. I mean, not to go to there's a bathroom in the room, so we didn't need to leave, but couldn't go get food, couldn't go back out to our car, couldn't go get water, which was more of an inconvenience than anything. But I will say we didn't know about that in advance. So we didn't bring our own snacks. We didn't bring our own waters. We just showed up with our clothes and stuff, and we thought it would be fine. And then we had to page the nurses for everything. Like if I needed my water refilled, I had to page a nurse. And it would take a while, because that's not normally part of their job, which I totally understand. And they did say, the policies, again, were changing every day. But again, if there had been some proactive communication about that would have been helpful. We could have brought our own stuff and, been more comfortable ourselves and saved the nurses that inconvenience. But overall, again, it was more of an inconvenience than anything. And while we were in the hospital, the nurses did tell us that, they weren't going to the doctors weren't going to come around as often, just because they wanted to limit contact. As long as everything was going well, they wouldn't be in all the time with us. So we had, again, I don't have a basis for comparison, but we didn't have a ton of people coming in, just to check on us. We did have, because Natalie was born, she was only 6 pounds. She was in the 9th percentile. So her blood sugar was monitored. So they were in every 3 hours to do that. But other than that, we didn't have a ton of contact with the doctors and nurses. They did do a check-in with me every day. But besides that, it sounded like they would have come around more often if not for COVID. But again, that was okay, because I didn't need them to come. When I did page someone, a nurse, they came right away, and, it felt like they were taking precautions to keep us safe. So that was good. So yeah, overall, it's definitely challenging not being able to have family around in the beginning was probably the hardest thing, and just having to make so many decisions of what was the best thing to do to keep her safe. You know, if she needed diaper rash cream, it was like, well, is it worth, do we risk going out to a store, or do we order it and wait a couple of days for it to come? So those types of decisions, on top of the, you know, the learning curve of being a new parent, made it tough. But overall, you know, I think we've been doing okay, and hopefully this is helpful for new moms preparing. I would say bring your own snacks to the hospital, yeah.
Next, we'll hear from Ashley, who gave birth to twin boys at a hospital in Boston.
Hi, Ashley. How are you?
I'm all right. How are you?
All is well. Congratulations on your delivery.
Thank you.
And I just wanted to hear more about your journey, you know, and how you overcame your challenge of being able to deliver in this pandemic. So let us know, where did you deliver? How was your experience at the hospital?
It was a bit tough. The boys had to spend a few days in the NICU, well, more like 7 days. I was readmitted to the hospital because my incision reopened. It was a little tough, but I got over it.
Okay. So a few more questions. So at how many weeks did you deliver?
34 weeks.
34 weeks. Wow.
Yeah, I was actually at an appointment, and they told me that they weren't growing, so they had to do the emergency C-section.
Okay. So you have twins, am I hearing? Is that what I'm hearing?
Yes.
Oh man, twin boys. Wow. So you say they weren't growing. Wow. You had your C-section. Like, how did you feel going into the hospital? So you went for your appointment. So it was face-to-face instead of telehealth on the screen, right? It was no Zoom.
Yeah.
All right. How was that? Like, when you walked in, did they check your temperature? Like, walk us through that moment that you knew you were about to deliver and didn't know?
Yeah, they always check people's temperatures and stuff.
Okay.
Every time. And then to visit the babies at the NICU, I had to go through that like every day.
Okay. So you go to your appointment, 34 weeks. They say baby's not moving. We're having a C-section. In how many hours did you see yourself getting ready to have the C-section?
I believe it was like 12 or 1 o'clock, and I had the C-section around 5:30.
Okay. They give you some time to make things happen on the other end with your other child. You said you had to find care, right?
Yeah.
Wow. Okay. And who did you have any supporters as you were getting this information?
Yeah, I had a lot. My whole family.
Okay, good. So after you delivered, had the C-section, everything went well. Were you able to do skin to skin with your baby before they went to the NICU, or how was that? Do you remember that part after baby being removed from your body, from your
No,
womb?
I only saw them when they took them out, and then I had to wait like 2 or 3 days to see them at the NICU because they made me take the COVID-19 test again, because I took it 2 other times because I went in to the hospital feeling out of breath.
Okay, so they were concerned. Okay, so hello, how are you?
Hi,
beautiful. We're talking about mommy's birth story. We just want to be able to walk the lane as mommy went to deliver your brothers, your 2 brothers. All right, so in some ways, it sounds like the pandemic, COVID-19 affected you in a way that it was, you say annoying, but it seemed like you had to take the test repeatedly, even though you were already in the hospital after you delivered. So you weren't able to see,
negative.
and it was all negative. How many days did you have to wait, or hours, to be able to see your babies in the NICU?
They told me I had to wait a few hours, but they made me wait a couple of days.
Wow, that's disheartening. How did you feel about that when you heard that?
Yeah, I was really upset because that wasn't fair, especially if I had already taken the test. And then having to wait for the results was hectic as well.
And how was your breastfeeding experience knowing this took place? Like, What was your attitude of wanting to be able to breastfeed?
Breastfeeding was kind of upsetting because I wanted to do skin to skin breastfeeding, but instead I had to pump like for a whole month. And then I wasn't producing enough, so I stopped because it got stressful. And yeah, that's pretty much it.
Yes, stress can play a big role in being able to produce milk. That can be challenging. And who were your supporters around to be able to, say you can do this? I mean, you pumped for a whole month. That's a big deal. Like,
Yeah, I brought them a lot of milk to the hospital, like more than 10 cups.
so it sounded like you had a drive to make sure that your babies came out of the NICU with your breast milk.
Exactly.
And that's a big deal.
Yeah.
So you should be very proud of yourself.
I am.
Now, my question to you is that what would you say to the hospital? Like, how could have they supported you much better? Did you feel you received the support you needed when you were there during this pandemic?
Yeah, I received all support during the pandemic, but I feel like the whole COVID testing was unacceptable. They didn't communicate with me so much because they were trying to avoid coming in and out of people's rooms, but I was calling them every 2 to 3 hours, and I think they were getting annoyed, but I didn't care.
How do you know they were annoyed for you advocating for yourself and your children?
I mean, they just kept saying, "Oh, I'm gonna page the doctor. I'm gonna page the doctor. I'll get back to you," and the doctor never got back to me. So I just kept calling and calling until they gave me the results.
Okay. So my other question would be, what would be a few things that you felt made it challenging during this pandemic, for your prenatal care?
Having to wear the mask or doubled mask because of the breathing, when you're big and you're out of breath. I think just the mask part. And then also, I think the visitations for the appointments where you would come with someone, but they would have to wait outside. They wouldn't come in with you.
That was tough. And when you had your C-section, was there anyone was there any of your supporters?
Yeah, my mom.
Okay. So she was able to be in the exam room during the C-section, or?
Yeah.
Okay. Yeah. All right. And what was your mom's story about it? Like, I know you guys talked. Like, what was her reflection on how this turned out? What was her comment? Go ahead.
She was happy.
Okay.
It was the right thing to do, the C-section, because the babies weren't growing. So if I would have waited longer, I know they wouldn't let me wait longer, but if I would have, then maybe something would have went wrong. But then again, I don't know.
Right. So if I was to deliver in the hospital today or in a couple of months, what would be your tips due to the situation you went through? Like, what would I need to know so that I can feel supported and have my power not be taken away?
I would definitely, the tip I would probably give people is make sure they're on top of the doctors and nurses so you can get the support and all the answers you need and help. Not having to wait like I did, basically. I don't know what else.
You're such a great advocate. I could definitely add to it. Like you said, stay on top of them and be able to speak and not be afraid to voice your opinion and how you feel, because it is your health care. It's your body, your children. Because once you leave, what were the resources that you received,
Right.
So, and do you have any messages you would share with maternity care? Like, do you feel the people in the hospital, the maternity care, what message would you share with them?
Well, that part, the part that I explained to you, I didn't like having to wait and all that process. But the NICU team, they were very helpful. They're so caring and loving, and they took care of my babies. So I'm thankful for them.
Oh, very good. We're thankful too. They provided and you provided. You're such a great advocate. Well, we are so glad that you had this time to share. We're sorry for the wait and how COVID-19 does affect the delay of being able to connect with your infants, like you said. But you did it. A whole month of pumping and providing for your babies in the NICU.
Yeah.
Oh man, I gotta drum this one. I gotta drum this one. Woo! It's awesome. Awesome. This is how we celebrate you. Thank you for coming to Mother Healing Center. I hope you're able to share this with other people, but this is a place of healing.
Thank
Thank
you.
you for letting us listen to you. You are so amazing, so
Thank you.
courageous. Thank you for your time. And tell your children thank you.
All right. Thank you.
Next, we'll hear from Balikis in Oklahoma City.
Hi, my name is Balikis. I had my baby in March 16, on March 16.
All right, thank you so much for joining us, Mrs. Gambari. So I'm just going to ask you a few questions about your birthing experience during COVID-19. So if you could tell me, what kind of worries did you have about giving birth during the COVID pandemic?
The whole pandemic itself, that's my worry. I was worried. I just hope we can just go to the hospital, safe, and get out as soon as possible. That's all. I was just worried. But at the same time, you just have to be optimistic. So
what kind of specific concerns did you have?
safety, safety in the sense that infection control. I don't want the virus, it spreads so fast. So I don't want I don't want me to get infected or my baby to get infected. So that's why I keep saying I don't want us to stay long. The longer you stay, yeah, the more risk you have. That's basically my worry, my concern.
Okay, thank you. And did you have your baby vaginally, or how did you have it? And did you have any concerns about that?
Yeah, I have a scheduled C-section, and I was worried, basically the major concern about C-section is infection. So, but it's not my first time, and that's not and the first hospital. So when it comes to infection control, I know they are very, very good. So, but I'm just worried about individual. I mean, the nurses, the doctors, yeah. But in a nutshell, they all tried.
Okay, that's good. So what can you tell me a little bit about your prenatal care? How was that affected by COVID-19? When you compare it to your previous experiences?
There wasn't anything like COVID or at the beginning of it, but towards the end of it, it started spreading and it's been known that something is going on. So at times I feel so reluctant to go for my appointment. I will be like, do I need to go? I could remember there was a time I had to cancel my appointment, not because of anything, but I just felt like the last time I went, they have a lot of people at the waiting room and some were coughing and the precaution, they have kids around running. And I'm like, do I want to come here again? Not, not because of anything, but just because of the pandemic that you don't know who is a carrier or so that's why I'm always like I just don't want to, even if I'm going to go, I don't want to stay more than expected.
Okay, so how would you have preferred to do your prenatal care? Like, what do you think they could have done to make that easier or make you feel safer in that instance?
I know for pregnant women, they are very, very vulnerable to the pandemic. I would have suggested a visual, like recorded doctor to patient appointment, or I would have suggested that one so why you don't need to go. But sometimes even when you have to go, you have to do some urinal tests and you might need to be present at the hospital. But if you don't have any initial complications and you don't have any complications, I would have suggested that you don't need to go to the hospital. Just call your doctor through Zoom or any means of communication and just talk to your doctor what you need, what you're experiencing, if you need to come to the hospital, if you really, really need to come to the hospital. If you don't need to come, I went to hospital just to see a doctor, because basically that was what I did all through. I went in there to see my doctor, talk to my doctor, and I'm out. So if you don't need to, you don't have to.
Okay, thank you so much. So what did the hospital do to support you when you went in there to have your baby? Because you had your baby in the hospital. So what did the hospital do to support you, and what do you think they could have done differently?
Oh, I believe they use all necessary precautions, whereby this you can only have a visitor to yourself, just one, and the particular person has to be the same person every day. So I think on that, kudos to them, because my previous delivery, my friends comes in every minute, in and there. So I believe that I like the policy that it's just one person and it's just that particular person that can be with you all through your hospital stay. So yeah.
So was that was the visitation policy was something we're completely fine with, or were there like downsides to that?
Honestly, no.
Mm.
No. I really love the policy, and they should just keep it up. That way it can reduce the number of people that are affected by the COVID. That way it can, if you don't bring it in, you can take it out. So yeah.
Okay. Thank you so much. So do you have any messages for nurses and doctors in maternity care during this period?
Honestly,
In general.
yeah, honestly, when I was at the hospital, when I had my baby, they all tried. And to add more to that, they just need to be more supportive to the patient, because the fact that she doesn't have anybody with her, and the person might have to, like, just like when my husband was there, he has to go do some errands. We have kids home, he has to come check them. So they just a little bit like, let them know, yeah, we are here for you, which they did. Yeah, which they did, honestly. It did.
Okay, so just to recap, having that support from your health providers was very important for you in that moment, especially since you didn't have a lot of visitors, or you didn't have anyone around to support you, as opposed to how you did in your previous deliveries. Okay, thank you. So can you share any tips for women who might be in your situation? Any advice or information that you'd like them to have? Maybe women who are going to have their own baby during this pandemic, or those who have already done it, just in general?
Honestly, I'm just going to tell them to be optimistic, enjoy the moment. Don't think about the pandemic. It's so scary. So you don't have to put that. You have a joy coming in. So you have a baby coming in. Oh, don't think about the pandemic. Just put that at your back and be optimistic that nothing is going to happen, and nothing definitely, nothing will happen to you. So just be fine, enjoy the moment. Yeah, don't weigh don't weigh yourself down before the baby comes, because it's going to be a beautiful experience, pandemic or no pandemic.
Okay, wonderful. Thank you so much for sharing with us, Mrs. Gambari. We're really glad to share your story, and we hope that you have a nice day.
Next, we visit Clarksdale, Mississippi, where we'll hear from Lucy and Robert about their recent hospital birth.
Hi guys, my name is Lucy.
And I'm Robert.
And this is our baby boy, Robbie. He was born on April 3rd in Clarksdale, Mississippi. And so it was in the peak of the COVID-19, we hope.
Pandemic, yeah. We just want to share a little video with you guys to let you know that, yeah, you're going through this now, but you're not alone. People have gone through it before you. People are going through it with you now, and maybe if we share a little experience, it'll calm you down and let you know you're not alone. That's all.
Yes, so our definitely biggest worry was that we were concerned that either one of us or him could get COVID, and we were, especially for him, worried that we didn't know what can it do to a little baby. The second worry was that we were not sure if his dad is going to be able to be in the hospital with us, and if he's going to be able to be there to support me and get me through this.
Yeah, at the time...
and see him for the first time.
With the prenatal care, we weren't... towards the end, I wasn't allowed to go into her appointments anymore. I had to just sit out in the car, and she, would go into appointments without me. And we didn't know how the hospital was going to be, and it was changing day to day. Fortunately for us, at the last minute, I was allowed into the hospital. Now, I was even allowed to come and go. I know some people that didn't happen to be the case. I was allowed to come and go. Everyone was wearing masks. I tried to do my part and bring masks for some of the nurses and stuff who didn't even were low on them, let's say. But everybody was wearing their own or homemade masks, and everybody's kind of doing the things that we were supposed to do for Corona at the time. But again, I was fortunate and I was able to come and go. She was there for 3 or 4 days before and after recovering from the C-section. Yeah, I mean, as far as worries go, I just was worried about that, being able to be in there. And then not so much like us catching it, because even at that time, we kind of knew who it was affecting, and it wasn't affecting people our age so much. But I was really worried about him, and what that might be. Obviously, nobody wants to see something like that occur. And so I think that was my biggest fear, was, we didn't know how it was being transmitted, how easily it was being transmitted, and if that would affect a little baby. We didn't want little Robbie to have any problems, obviously.
Yes.
What do you think?
Oh, no, 100% agree. Like, in a hospital, that was my first time in the hospital, and to be honest, I felt we were kind of able to almost forget about some of it. There wasn't many people around, like in the hallway, there was nobody almost at all time I was there. Anytime I took a little walk or went to see him to the nursery, all the nurses were always wearing masks. They were always there for us whenever I needed them or him, and they were very helpful. Yeah, we were all just hoping for the best, and kind of, at least for me, I was trying not to think about the COVID-19 as much, because, we all did what we could. At least I felt like it. And I didn't want to stress more to maybe make him feel it and be upset as well. So, yeah.
Yeah, the healthcare workers are great. And in our experience, we delivered right here in Clarksdale, and loved the hospital here. The food was excellent. We joke about that, but it really was. And yeah, I don't see how there's no complaints there. I don't see where that could have been better. The aftercare, and then going through to now with the pediatrician, following up with her, and they're taking all the necessary precautions and stuff as much as you can do. We're happy with everything.
Yeah, and we're just hoping that everybody will have the same, as pleasant of experience as it possible can be, considering the circumstances. And for us, the huge deal breaker was that Robert was able to be there for us and with us, and he saw him before I actually even did. So, yeah. And good luck, everybody. Just be strong and know that everything is going to be all right. Bye, guys.
Bye.
We will now hear from Tyra, who had a home birthing experience in Brooklyn, New York.
Hi, my name is Tyra Khalid. I live and am from Brooklyn, New York, and I gave birth to my son on June 1st, 2020 at home. So my husband and I were planning on a home birth from even before conception, and it turned out to be a fortuitous decision for a lot of reasons, which I will get to in a second. But as far as prenatal care goes, in terms of how that was affected by the pandemic, the first major change to occur was that we were told in March that our visits would be virtual, which eliminates what midwives usually call the hands-on portion of the visit, which is often the most exciting part of your care, which is listening to the heartbeat and palpating the belly to get an understanding of what position the baby is in. Losing access to some of those experiences was definitely disappointing. However, the rest of the visits could operate pretty much as normal, since the majority of prenatal visits in the home birthing community are about building relationship and talking through your thoughts and questions, so on and so forth. So that was the first major change. And otherwise, our prenatal care stayed pretty much the same. So the unique stress that I started to feel, in terms of the initial kind of stress that I started to feel when quarantine began and social distancing began, was the absorption of some of the anxiety that I thought perhaps my care team might be feeling, in terms of trying to avoid getting sick, whether or not that would change the care that they provided, which it didn't at all. But this idea that somehow I would feel a lot more isolated in labor than I had anticipated. And that was really hard initially. Was trying to figure out what that might look like during labor. But I was able to come to terms with that, and sort of realizing that, well, one, talking to my midwives, who reassured me that they weren't particularly anxious, and that they felt that they were being very safe and were comfortable with the precautions that they were taking to ensure the best care that they could provide. And also I realized that birth ultimately is about the laboring person and their own journey and their baby, and being able to ground myself in that changed a lot of my perspective as well. A huge element of giving birth at home is this idea of safety and security. Here in New York, there was about a week period, I think towards the end of March and the beginning of April, where many hospitals were saying that birth partners would no longer be allowed in the birthing space. And that seems especially cruel. And that, to me, is sort of the anxiety that occurred on an institutional level that was actually really, I think, damaging to a birthing person's experience, because my understanding and my belief, and this is sort of my message to any healthcare provider in this particular arena or field, is that laboring people and birthing people are better off. Everyone is better off when that person feels safe and secure, regardless of what the environment is. Safety and security and trust in your environment is paramount, I think, to the laboring process, and that's, I think, really, really important. And to remove some aspects of that safety, for example, a support person, is really, I think, detrimental to the entire experience, and probably has some adverse outcomes. Luckily, there was massive public outcry here in New York, and so that decision was reversed pretty quickly. But my understanding is that giving birth in a hospital was not necessarily any less stressful, or that there were other stressors that certainly existed nonetheless in the hospital setting. And I felt incredibly sympathetic for the people I knew who would be giving birth in that setting. And luckily, people have had some really positive experiences here, so I'm reassured by that, although my situation was quite unique. So in terms of care, and care specific to the pandemic itself, the way in which it has changed this experience of birth, I think it's also really important to consider postpartum care. Prenatal care has changed, obviously. The labor and birth experience has changed, but there hasn't been as much emphasis. And traditionally, my understanding is that the postpartum period is really when care providers sort of take a back seat or step out of the picture all of a sudden. But it's an incredibly vulnerable time and requires just as much care and attention and support as the prenatal experience and the actual labor experience. So in terms of people who are preparing to have children, I am considering and thinking about what postpartum care looks like. And if your healthcare provider isn't a part of your team or your plan, then who might be? Because a lot of people have had to make some really difficult decisions and modifications in terms of who can visit and what family members are allowed. But I think the most important piece of advice that I got is that it's not just about weighing the cost and benefits, or doing like a risk assessment. It's also about thinking where your mental health and your needs, your physical needs, physiological needs are, and weighing really what the benefit might be to you. And in some ways, for a lot of people, having someone around during that postpartum period, not just their partner, or if they're partnered, but having someone who, in addition to that, in addition to whoever the unit is, to help out can make a tremendous difference, because it is such, like I said, a vulnerable time that is often overlooked when we're thinking about healthcare. So I would say, to summarize, that the biggest impacts of the pandemic on my birth experience were related to feeling socially isolated, questioning any anxieties that were occurring both on behalf of, on a micro level with my midwives, and then also on a macro level, understanding what that looked like in a more institutional setting. And then also thinking about what the pandemic has meant for people in their postpartum period, which is already can be a very isolating time, and can be made harder when you're being told that you actually have to socially distance yourself from other people. So those are, I would say, the main pieces, the main takeaways from my experience with regards to care and the pandemic. And I recognize that I'm extremely fortunate in being able to give birth at home, because, like I said, the most important thing, I think, for laboring people is being able to do so in a space where they feel safe, secure, and supported. I hope that helps. Thanks so much.
Our last story comes from Wandiba in Manhattan, New York. Wandiba's experience will be shared by Carla Lewis.
Hi, my name is Carla Lewis. I'm the breastfeeding coordinator and one of the IBCLCs at the Morsania WIC program in the Bronx in New York City. I recently talked with and interviewed one of our very active breastfeeding moms, very active in that she's come to just about every breastfeeding baby cafe that we have had, virtually and in person since March. We caught up with her 24 days after she had her sweet little baby, and asked her some questions about her experience about giving birth during COVID. And these are some of her answers. I honestly wasn't worried about the pandemic affecting me when giving birth, which I know makes me seem a little crazy. I've always practiced good hygiene and other health measures when going out. Granted, I am aware that this virus is a little different because there is still so many unknowns about it, and there is no vaccine or medicine for it, but that gives me all the more reason to continue what I was doing. I, of course, did not want anything to happen to my baby either, so I made sure to go to the hospital that kept the babies in the same room as their mom the whole time. I asked our mom, Wandiba, to tell me some about her prenatal care and how it was affected by COVID. And she said, I was able to go to the clinic and get checked for my prenatal visits. This was important to me because I wanted to make sure my baby was healthy and growing as she should. This was especially important when I started fasting for Ramadan. I looked forward to going to the doctor's office every week for my checkup, to get weighed and listen to the baby's heartbeat to make sure I was still gaining weight and the baby was doing well. We asked Wandiba about her experience in the hospital and what did they do to support her, and could they have done anything differently? And she said, I did have my baby in a hospital. I went to the hospital twice. The first night to find out how far along I was, and the second night because I thought I progressed enough that I would deliver soon. The hospital does not allow anyone to go up to the triage with the expectant mother, but once she is admitted, she can have her support person along with her doula or midwife. So the expectant mom is all alone in the triage room, and I think this can be a very scary time for a first-time mom, or even a mom who is worried about the pandemic but they don't have their support person to comfort them. When I was in the triage room, I didn't see or hear from anyone unless the nurse came in to strap my belly to monitor my contractions and the baby's heartbeat and to hook me up to an IV. The first night I went, I had to call out to the nurse a few times before someone heard me to unhook me from the machine so that I could use the bathroom. The only other time someone came in the room was when the doctor came in to check how far along I was, which was a little over 2 hours in between visits. The second night, I was not strapped to the machine as long, so I was able to walk around the room and go to the bathroom without calling for a nurse. My friend, who also happens to be my doula, was texting me things I can do to help ease my contraction pain, but also to get them active, so I would be able to continue to dilate. After I was admitted, my friend was able to join me, and I had more access to the nurse, so I wasn't as isolated. However, I think that the triage nurses should have a call button for expectant moms so that we are not yelling out of our rooms, especially because they do not have anyone with them who can call a nurse on their behalf. So the message that I would give to healthcare workers and maternity care during this period, and the labor and delivery and postpartum rooms, I think everything is fine and seem to function as normal. However, I think the triage, either let the expectant moms have one support person or give the patients a call button to be able to communicate with the nurses if they need something. And to make sure to tell mothers to have their phone charged so that they can communicate with their support person via text, call, or video. Ask the nurse if there's a call button or a way to contact them if you need something or have a question while you are strapped to the bed alone in the triage room.
All right, thank you so much. So I'm going to go over this slide here, just a few slides, and then we can get to the Q&A. So this is just a slide that contains or features a lot of different resources that we have on our website as well. So just, so people can stay informed about COVID-19 and the changes regarding COVID-19 as it relates to maternal child health care and pregnancy and breastfeeding. So now questions. If you have any questions, please feel free to unmute yourself and ask the questions directly or use the chat box, whichever you would prefer.
They mentioned maybe Dominique or Teresa or anybody who is helping there. I then share there's about breastfeeding. Anyone has anything to share about that?
It looks like, hi, Dominique, part of Mother here. To be able to answer that, I definitely agree with you. Communication was hard, but I think we just, as providers, as friends, as family members, we really need to stress to our families that, one, to have the phone charged, and two, we really need to advocate or train or teach our families and friends on how to maintain communication. Any family I serve, I do stress that their voice is very important. And, it's their choice, and everyone needs to be able to be supportive. And if someone isn't supportive, they have to be able to have a plan A through Z if possible. It is challenging and disheartening to hear that a lot of families' voices are not being heard, especially the individual. There's no call button. How is it that you're in a hospital and there's no call button? But I think our greatest job we have to do is making sure that families are not afraid to speak up, because they are customers and they do need our funding to kind of keep the hospital doors open. And, I always say, try to build a relationship with each nurse that's on a different shift, so that there's a connection, so that when they do hear you need support, they're happily there to service. Let me know your thoughts.
I've had a very bad internet connection during this presentation, so I missed a bit. But my question is, does anyone have stories about breastfeeding, or do any of the doulas or the peer counselors? Because we didn't mention breastfeeding, which is kind of interesting given the forum here. No one's mentioned it. But what sort of experiences have you heard from women about breastfeeding in the epidemic, especially sort of in the hospital-based setting?
Dominique again. One thing I thought that was really interesting with Ashley was that because her baby was delivered at 34 weeks, she didn't have the chance to do skin to skin or even face skin to skin, either on the chest or face. It seemed like baby was just taken abruptly. The fact that she wanted to breastfeed, because it sounds like she breastfed her 3-year-old, she lost that opportunity. I know the hospital wants to focus on safety, but I think they also were working on fear. And I think that makes breastfeeding really challenging for a lot of the families. But some families who didn't have challenges, they were able to do skin to skin and nurse their babies. For a lot of the families that we served that did, who delivered during the pandemic. But a lot of the families, because of the pandemic, they're flexible. Even though they say, hey, I want to be able to breastfeed, but they also understand why the nurses or the doctors are reacting the way they are. But it can be a disadvantage to the families who wanted to do skin to skin right away.
I see Maggie's on also from Mississippi, and Teresa. Anybody else got any feedback about breastfeeding particularly in the hospital, whether people were told to breastfeed, advised not to breastfeed, anything?
This is Teresa.
So Shelley mentions on the chat. So I'll just read out Shelley's comment and then we'll see. So Shelley, who I know is a peer counsellor in Mississippi, has added a comment here that also she works for WIC and overseas peer counsellors. She said that a few moms have enjoyed less visits because it has been nice to enjoy their infants alone, which is an interesting thing that has been raised before. So that's quite interesting. Go ahead, Teresa, go ahead, and then we'll read out more comments afterwards.
That's okay. And, you know, we've heard that same comment that for breastfeeding in particular, when there were less visitors, and visitors are not only friends and family, visitors are the TV man, the birth certificate person, and all that. You know, there are 54 people going in and out of a room in 48 hours. And our moms were discharged and are still being discharged at 24 to 36 hours. The mom, Wandiba that Carla spoke about, is someone who's been with us for a while and had a lot of breastfeeding education and support. And Carla had shared with me that they worked really close with her during Ramadan because she was so concerned. And she's an exclusively breastfeeding mother, probably more because of the support she's gotten over the few years with us than anything that happened in that short period in the hospital. I will say it's very different now in New York than just a few weeks ago when I spoke with you. Our numbers are going down, and today it was announced in Health and Hospitals that all patients can have a visitor, one visitor for a cumulative period of 4 hours. In the beginning, it was really challenging and communication was awful because they didn't know. And I think they got really very little breastfeeding support in March and April. In May and June, it started normalizing a little bit with them having their partner or whoever with them and getting a lot more support and having skin to skin and rooming in. So it's on the better turn now. But for those of you in states where the numbers of COVID are going up and you thought that you were all finished with this and you weren't going to be affected, I will encourage you to learn from our mistakes, because in the real beginning, some hospitals were allowing rooming in, others were not. Some hospitals were separating mothers that were positive only to have them discharged with their babies at 24 to 36 hours. Made no sense. So hopefully the hospitals and states that are facing these high numbers can learn from those of us who faced it in the beginning and do a better job, because it was not a good job in the beginning.
Yeah, thank you. And also comments in the chat here that that's, I'm not sure who all of the people are, because some of you have code names, but somebody has said that breastfeeding is more exclusive overall. And hugs to the moms who are not well heard and supportive, but this particular hospital has not had to separate any moms and babies. And Shelley again has said she feels that there's been more breastfeeding since COVID-19, but it's been difficult for no in person. You know, I think sometimes, you know, some of us, I won't identify with any group, but some of us prefer to have more visitors and some of us prefer to have less visitors. So I'm sure it really affects different people differently. And some of us breathe a sigh of relief if the in-laws are not coming, and some of us are really unhappy. So I think that's something that really the patients, you know, have to determine. But the reality is that definitely people are getting less contact. And as someone else just shared now, the visiting policies have been like they have not even had access to screens and virtual methods of support, so that's been very difficult. Anybody else want to comment? I wonder if we have anyone on the meeting from any of the places that are really experiencing bad COVID right now, which would be like Texas, Florida, Arizona, and some of the Louisiana's beginning. Anyone got anyone from any of those states online who wants to say anything? Kimberly Ramsey, who's the head of WIC in Mississippi, said she's been looking at the breastfeeding initiation rates among WIC patients during this epidemic, and that they've had increases in certain areas of the state, but a slight decrease overall, which is interesting. And certainly, you know, we're still continuing to look at the CHAMPS data from all the Mississippi hospitals. And I would say that overall, and it changes as we get in more data, but breastfeeding rates have not gone down. Rooming in rates have slightly gone up, and skin-to-skin rates have gone down. But we continue to sort of assess that. And I know those of you in Mississippi, you are beginning also to see quite a big increase, and also some issues around releasing the results. So I'm kind of wishing you a lot of luck with that. Well, anybody got any broader questions that don't necessarily have to relate to this particular webinar? Any other questions for the CHAMPS team or any of the experts or the other people on the phone, on the screen, on the call? We have a lot of people on from WIC. That's great. And thank you. I do want to thank, especially Dominique, thanks so much for helping us to facilitate this. It was really helpful of you to, it was quite difficult to pull so many people together to give stories. Thank you, and thanks to my team for a few friends and relatives who've all with their stories, so that's been helpful.
Thank you for having me.
Oh no, it's been wonderful to have you, Dominique. Thank you for helping you with our various webinars. We owe you. Thank you.
Yeah. And just one other thing. I mean, it had been hard. Carla read the story because this mother, who's usually very, very vociferous and very comfortable speaking, was not so comfortable speaking. So that's why she wrote it and Carla read it. And some of our families that had really been traumatized by the births just weren't ready to speak about it. And then Mytel, being the wonderful person she is, she said, well, even people who had good experiences, let's hear why. And we kind of changed, you know, our focus a little bit with that. But Dr. Melissa Bartik, as many of you know, is trying to do a survey. And you might have it. If not, I could share all. There's a certain way it's supposed to be shared, and they have certain requirements, and the baby has to be over 30 days, but less than a year. And I could share that with you, and you could use it as you see fit, unless you probably already I imagine you
Well, we
might.
can certainly I think we've probably posted the link before, but certainly we can help to facilitate that. Yes. Kimberly from Mississippi just put on here, Kimberly, the WIC director, that it was so nice to hear perspectives from all over the country, and I would add to that, from all types of birthing mothers, all different races, all different locations, people obviously coming from many different perspectives. I think it's really important to recognize that there are all these different perspectives, and that nothing is shared exactly, and yet everything is shared, and people coming in with different expectations and people taking different things away from this. But the one thing is, just like COVID throughout the world, everyone is experiencing something. So, I think it's great for us to be able to share these very different perspectives. So if no one has anything to add, thank you very much. Aisha, did you want to round it up? Do we have anything? Please, if you have comments and maybe you're too shy to bring them up, send them to us, and we can also put them onto our Q&A forum so that we have questions and answers there for people.
Absolutely. So thank you everyone for joining. We just wanted to remind you to join us for the next webinar next week, same time. We're going to be sharing creative hospital and community interventions from this period of COVID-19, and just highlighting innovations in maternal care developed by hospitals and communities, and just how people have adapted and risen to the occasion, and just tried to get through this, I guess, ongoing pandemic together, and individually. Anyway, so thank you so much for coming. I hope everyone has a nice day.
Thank you. And I want a drum, Dominique, okay? I just need a drum. Okay, guys, thank you. Thanks, Aisha, for presenting, and thanks, Aisha Mittal, for putting it together, and everyone that contributed. Thank you very much. Bye-bye.